पापा को व्हाट्सएप कर दूं?
We are live in 3, 2,
Okay.
1. We are live now.
Welcome all.
Yeah, I think Dr. Vishal, you can start.
Okay, madam.
Yeah.
Good afternoon, everybody. Myself, Dr. Vishal Dave. I am medical advisor at Intas Pharmaceuticals, Head Office, Ahmedabad. On behalf of Intas, I welcome Master of Ceremony, chairpersons, speakers, panelists, and participants to the webinar on ART law. It's my honor to introduce Master of Ceremony, Dr. Shraddha Agrawal and Dr. Shabana Sultan. Dr. Shraddha Agrawal, madam, is working at a district hospital in Bhopal. She is eminent LTT surgeon. She is eminent LTT surgeon of Bhopal division. Has done around 40,000 laparoscopic tubal ligation. She is faculty CPS course, master trainer CAC, master trainer MLC examination. She has published 8 papers in Index Journal. She is secretary of Bhopal Menopause Society. She was former president Foxy Bhopal. She was former secretary AMPOGS. She was organizing secretary of All India Adolescent and Juvenile Gynecology. She was organizing secretary of West Zone UA Congress, attended various conferences as a faculty. I am also
Dr. Vishal, we are not able to see her CV on screen. Share the screen.
Already screen has been shared, sir.
No, it's not visible. Webinar of the RT is coming. The CV is not coming. Just share.
Mr. Ronak?
Yes. Yeah, share the slides. Dr. Shraddha Agrawal.
Sure, sir.
CV.
Can you please stop screen sharing? I'll do my screen
I
share.
will stop sharing. I repeat, Dr. Shraddha Agrawal, madam, is working at District Hospital, Bhopal. She is eminent LTT surgeon of Bhopal division, has done around 40,000 laparoscopic tubal surgery. She is faculty of CPS course, master trainer, CAC master trainer MLC examination. She has published 8 papers in Index Journal. She is secretary of Bhopal Menopause Society. She was former secretary of AMPOGS. She was organizing secretary of All India Adolescent and Juvenile Gynecology. She was organizing secretary of West Zone UA Congress, and she has attended various conferences as faculty. Kindly show the CV of Dr. Shabana Sultan. Dr. Shabana Sultan, madam, is professor in Department of Obstetrics and Gynecology at Government Medical College, Bhopal. She has presented many papers in national conferences. She has published many papers in national and international journals. She is member of esteemed team of PPH Mandal along with Sevagram. She was past joint secretary of Bhopal Obstetric Gynec Society. She was past treasurer of Bhopal Obstetric Gynec Society. Presently, she is secretary of Bhopal Obstetric Gynec Society. She is also executive member of MP chapter of ISA. She has done various international projects along with Harvard University. She has special interest in gynec oncology and high-risk pregnancy. She is also master trainer of cervical screening program. Now, I hand over the program to Dr. Shabana Sultan.
Thanks, Dr. Vishal, for your nice words. Good evening, everyone. I'm privileged to be a part of this webinar, and it's in Perfection Series, Season 1 webinar on ART law. And I welcome all the members who've joined for this webinar. And without wasting any time, I'm just going to invite Dr. Randhir Singh, sir, for introducing the concept and objective of this webinar. Can you show the CV of Dr. Randhir Singh, sir? Dr. Randhir Singh, sir, is a senior embryologist. He's an infertility specialist. She is ASHRAE certified embryologist. He has various award and presentation in his credit, various international paper he published. He is organizing chairperson of 27 annual SR, which was Super Success 2023. And also he is director of Bhopal Fertility and Endoscopy Center. I welcome you, sir, and I invite you for objective and concept of this webinar. Please tell us the concept and objective.
Yeah. Thank you, Professor Shabana. This is very kind. Without wasting a time, just I will brief in the short that we have started this webinar series soon after our conference, and the main objection that out of 3,000 existing ART centers, Dr. Nitish is here. All the states have only few states have done completion. Our state is just in the process of getting registered with that. So the concept has to be cleared. What a routine gynecologist has to be, it is like a PCPNDT, which had come in late 90s. So after 20 years, again, an act like PCPNDT has come. So anything before, because in PCPNDT, before buying a machine, you have to take every permission. So here also, infertility means you have to be a little cautious. And what this coming 2 hours will come. So now, thanks. And I hand over the mic to Dr. Shabana.
Now I welcome Dr. Monica Singh, madam, for inviting our national faculties and welcoming our national faculties. She's a senior gynecologist and fertility specialist of Bhopal Fertility Center. She's associate professor at Medical College, Bhopal. She is vice president Bhopal Obstetric Gynae Society, vice president Bhopal Menopausal Society. She is a consultant reproductive medicine, organizing secretary of 27 SR 2023 conference, which was again a very much successful conference in Bhopal. Also, she has received various awards and presented many papers in national and international conferences. Over to you, Monica, ma'am.
Thank you, Dr. Shabana, for the very, very kind introduction. And it is with great pleasure that I introduce the Perfection series to everyone. And basically, this is a brainchild of ISAR 2023, because when we went through the conference attendance and we saw the response to the conference, we found the ART law was a bone of contention, means the halls were packed when ART law discussions and panel discussions were going on. The questions were never ending, endless questions, and so many queries even after the talk was over. I thought there had to be continuation after the national conference so that people who are wanting to understand ART law can do it one-to-one, face-to-face with the experts. And there are certain people in the country who are leading in this, who are doing a lot of work. They are doing a lot of research, not only clinical, but they are reading the law. They are reading between the lines. They are in the national board, the state board, and Dr. Nitish, Dr. R.G. Patel, they are there to help us all the time. They are there 24/7 to answer a query. So why not have this interaction in order to, spread awareness and to be crystal clear in a concept of practice as to what ART law is going to do to us, what good it will do to us. I've heard so many times Dr. Nitish telling everyone, this law is our friend, it is not our enemy. Don't be against it. So this is what the next 2 hours is going to tell us. Thank you so much.
Thank you, Dr. Monica. Now, moving forward for the first session of this webinar, and to start the first session, I invite Dr. Shraddha Agrawal, madam, to please start the first session, which is a talk. Over to you, Shraddha Agrawal, ma'am.
Thank you, Dr. Shabana. It is need of an hour to have this law, and everybody should know about it. Thanks, Dr. Ranveer and Dr. Monica, for organizing such a lecture, seminar, and that too online, so that all the members can join at a time. For the first session, we have Chairperson Dr. Shashi Srivastava, Chairperson, President Bhopal Menopause Society. May I have her, she's Director of Saurabh Nursing Home, President of Bhopal Menopause Society. She is life member of Indian Menopause Society, PCOS Society, and FOXY. Area of interest is recurrent pregnancy loss, sonography, and polycystic ovarian syndrome. Another chairperson is Dr. Anita Srivastava. who is President, Bhopal Obstetrics and Gynec Society. She is at present President. She's Assistant Professor at CMCH Bhopal, past Vice President, Secretary, Joint Secretary of Bhopal Obs Gynec Society, past Treasurer of Bhopal Menopause Society. She's trained in advanced gynecological laparoscopic surgeries, Senior Consultant at Chirayu Health and Medical Private Limited, Bhopal, and her special interest in routine obstetrics, high-risk pregnancy, adolescent health, and cosmetic gynecology. Now, session is handed over to Dr. Shashi Srivastava and Dr. Anita Srivastava.
Good evening, everybody. Thanks, Dr. Monica, and thanks, Dr. Randeep, for giving me the opportunity to join this session as a chairperson. I'd like to introduce Dr. Nitin Murtia. He is expert member, National Assisted Reproduction and Surrogacy Board. He is amongst many awards. He has won. One of the prestigious one is the Budding Embryologist of the National Gold by the ET Health World National Fertility Award in 2019. He is leading team of 160 embryologists setting educational program for national and international candidates, implementing accreditation programs and striving for clinical excellence. He holds a strong background in the management and SOP-driven systems. He has designed training for Indra Fertility Academy, which has trained over 350 embryologists and andrology candidates till now. He has special interest in artificial intelligence, new technology innovations, quality management system, digitalization in IVF lab. He brought an exceptional technological advancement in Indra IVF with the help of electronic witnessing, automated alarm, and cloud monitoring system, and QMS dashboard. I'll invite Dr. Nitish to take the chair session forward.
Thank you very much, and thank you for having me for this session. I have been asked to speak on level 2 clinics. Let me just share my screen. I hope you are able to see my screen.
Yeah.
Yes, we can see.
All right. So just a disclaimer, the views expressed are of my own. So let us look at what a level 1 and a level 2 ART clinic as defined in the law. So level 1 clinic is a clinic where till IUI procedure is carried out, and if any advanced treatment is required, then the patient has to go to a level 2 clinic, where of course things are defined that all the oocyte retrieval, collection, etc., has to happen at these clinics, which are the level 2 clinics. Let us look at what is the staff requirement for a level 2 clinic. You need one gynecologist, one anesthetist, one embryologist, a counselor, and the director and the andrologist is an optional. In terms of the qualification, a gynecologist who is a postgraduate in gynecology has performed 50 O1 pickups under supervision, and at least 3 years of working experience in an ART clinic can be qualified to apply for registration of an ART clinic. Or if a gynecologist, a postgraduate gynecologist, which has super specialization in doctorate of medicine or fellowship in reproductive medicine, she does not, or he or she does not need an experience of 50 O1 pickup. She just needs, or he just needs an experience of 3 years working in an ART clinic. When we look at embryologists, they have been defined into different categories. So if there is a postgraduate in clinical embryology with a full-time program of minimum 4 semesters from a recognized university, they would need additional 3 years of working in a ART laboratory. If there is a PhD holder in clinical embryology or ART or a fertility clinic from a recognized university, then he would require 1 year of additional experience in handling the human gametes and embryos. If there is an MBBS or a veterinary graduate with a postgraduate degree in clinical embryology, then he would need 2 years of working in the ART lab. there have been a lot of representations given from the society and other doctors, and due to which the things have been slightly relaxed. And what came in the regulation of the 7th June was that for a one-time measure, uh, embryologists who are graduate in life sciences or biotechnology or reproductive biology, veterinary science with at least 5 years experience working in a registered ART IVF clinic and who have performed 500 lab procedures and 100 cryopreservation will also be okay to go ahead, and clinics can use their experience certificate to apply for the registrations. Andrologist is MCH or DNB in urology with special training in diagnosis and treating male infertility, who can be a counselor, a graduate in psychology, clinical psychology, or nursing or life sciences. Anesthetist has to be a postgraduate in anesthesia, and director can be anyone who has a postgraduate degree in medical or life sciences or management sciences. What is the requirement of equipment? You would need a microscope, 2 incubators, laminar flow, sperm counting chambers, centrifuge, refrigerator, equipment for cryopreservation, ovum aspiration pump, ultrasound machine, and the other probes required for pickup, test tube warmer, and anesthesia trolley. Let us look at if there is a new clinic which is coming up after the law came into picture, then I will just read it how it is written. No person shall establish any clinic or bank for undertaking ART or to render ART procedures in any form unless such clinic or bank is duly registered under the Act. What about the existing clinics who were running before the law came into place, or a bank? Every clinic or bank which is conducting ART partly or exclusively shall, within a period of 60 days from the date of establishment of the National Registry, apply for registration. Provided that such clinics or banks shall cease to conduct any counseling or procedures on the expiry of 6 months from the date of commencement of this Act, unless such clinics and banks have applied for registration and is so registered separately or till the application is disposed of, whichever is earlier. So there are some states which have not conducted any inspection and not issued the certificates or registration certificate, but on the part of the doctor or the clinic, if you have applied, then you should be able to work. So till the time your application is rejected, and if you have applied, you should be okay working, be it bank or be it a clinic. I will just cover this quickly. Any new clinic who want to register, they can go to registry.art.surrogacy.gov.in. There is a login link here. You can log in. There will be 3 tabs. One is for the ART clinic, one is for the bank, and one is for the surrogacy clinic. You can select it accordingly. You can fill this form. If you are the director of the clinic, then you will have to put your name here and also in the gynecologist name. What all services that you provide at your clinic, you have to fill in 7, 8, and 9. So these are the things which you will have to tick. What all kind of services that you do in your clinic, and then you will have to take a printout of this form and submit it to the local authority. In terms of the fees, it is 2 lakh rupees to register your ART clinic. Ideally, the inspection has to be conducted from the state authority, and it is better that you make a file which has all the degrees, registration, qualification, and the list of the equipment with bill of purchases. The application can be granted, or there might be something which is not correct as per the authority. So they will let you know that you correct this particular aspect and send us back the required information, and based on that they can issue the registration or reject the registration. If they reject the registration, they will have to give you an opportunity of being heard. This registration is valid for 5 years, and after 5 years you will have to renew the registration. And just like how we do in PCPNDT, you will have to display it at a conspicuous place where it is visible to people. Any information related to these 2 acts are available on artsurrogacy.gov.in. Any new notification or anything comes, you can go to this website and you can find all the information listed here. Now let us look at what is the definition of ART. So it is basically all techniques that attempt to obtain a pregnancy by handling of sperm or the oocyte outside the human body and transferring of the gamete or embryo into a reproductive system of women. How they have defined as a commissioning couple means an infertile couple who approach an assisted reproductive clinic or bank for obtaining services authorized of the said clinic and bank. A woman, a single woman is allowed to undergo a ART technique. She should be above the age of 21 years. Let us look at what are the counseling and consent. So what I have divided into a few sections. So this is the first section which is important for all the IVF clinics, that counseling and consent, there are certain provisions in the law which you will have to maintain it properly at your end. So what the law says as per the 21C, that you have to provide professional counseling on implication and the chances of the success of ART. Now, this is something which is called informed consent also. You have to inform the advantages, disadvantages, cost, side effect, risk of arriving at an informed decision. You have to also provide the awareness on the right of the child born through ART. Do not perform any treatment or procedures without the written informed consent of the party seeking assisted reproductive technology. And the consent consent given by any couple or any party can be withdrawn before doing the gamete transfer as per 22(4). There are a set of consent forms which you will have to maintain as per the section 13F. I will just quickly go through these consent forms, but depending on what kind of procedure you are doing for a particular patient, you will have to maintain the consent form for those at your clinic. And whenever authority comes for inspection, you will have to produce all these forms. So this is a form number 6. It has to be signed by a couple or a woman undergoing ART treatment. There is form number 7 if you're doing an IUI with husband semen. There is form number 8 if you're doing a donor semen, IUI. Consent of freezing of the embryos is this form number 9. There were some questions about, what if the patient does not pay us for the renewal of the embryos or the sperm? You can go through section 0.1, 0.2, and 0.3. It clearly defines if a patient does not pay you, what is that you can do. And these declarations have to be filled in before the freezing of the gamete, and this has to be signed by the patient. So they will have to declare in case if they don't pay, what can be done and what are your rights. There is freezing of sperm, form number 10. Again, the same criteria which I showed you in the earlier form is written here in the 0.1, 2, and 3. Then there is freezing of sperm for minors, which require a parental consent, which can be done through this form number 11. And again, it has the same sections which are in the earlier forms also. Then there is consent for oocyte retrieval, which is the form number 12. Let us look at, I have made a few, 2-3 slides on this particular aspect. As a clinic, when you are operating, what all things that you need to take care. I have taken provisions out from the law. So as per the 21A provision, the eligibility criteria of a commissioning couple or a woman, the woman has to be between the age of 21 and 50, and the man has to be between the age of 21 and 55. It is always better that you maintain the age proof of the couple in the clinic with you. And whenever you do the initial registration of the couple, you ask for some valid ID proof which has the date of birth or the age of the couple. The clinics will have to obtain the donor sperm from the registered banks only. The clinic shall not, the woman shall not be treated with sperm derived from more than one man during one treatment cycle. So you cannot mix the sperm. A clinic shall never mix semen from 2 individuals for the procedure specified under the Act. Storage and handling of gametes, gonadal tissues, you have to ensure that there is a security, there is a recording and identification mechanism which you have put into place as per 28(1). All unused gametes shall be preserved and to be used on the same recipient and shall not be used on any other couple or, as the case may be, woman, as per 13A. The sale, transfer, the use of gametes, zygote, embryos, or any part thereof, or any information related thereof, directly or indirectly to any party within or outside India, shall be prohibited except in the case of transfer of own gametes or embryo for personal use with the permission of the national board. So the practice which used to be before this law came into picture is that there were some pathology labs who were doing semen processing and then supplying it to the clinic. there were some clinics who didn't have the washing facility, and they were sending it to some other clinic to do the washing and then send the sample back to this clinic to do a IUI. All these practices will not be allowed, because any movement of any gamete, be it sperm or be it egg, has to be approved by the national board, and then only these movements can happen. All unused oocyte of a donor shall be preserved by the bank. Now, this thing has been changed slightly in the regulation. So the preservation of oocytes can be done at the clinic level, because now the bank can just do the screening and registration and supply the donor to the level 2 clinic, so they can do the stimulation and pick apart. The clinic shall not cryopreserve embryos, gametes without written consent of all the parties, with special instructions in case of death or incapacity of the parties. So in case of any death happening, if you don't have a prior written consent form, you cannot freeze the sperm or anything of a particular patient. You need to have the consent form prior to that. The ART clinic shall allow cryopreservation of oocyte sperm for onco-fertility patient undergoing treatment and for other such conditions for duration longer than 10 years. You can preserve them for 10 years, but if you need to preserve them for more than 10 years, you have to have a permission from the national board as per 13B. The clinic shall not use any human reproductive material except in accordance with the provision of the Act to create a human embryo or use an in vitro human embryo for any purpose without the specific consent in writing of all the concerned parties to whom the reproductive technology relates to, as per 22(3). The clinic shall retrieve oocyte as specified in the regulation. The ART clinic shall ensure the controlled ovarian stimulation of a woman in order to prevent ovarian hyperstimulation as per 13C. Not more than 3 embryos may be placed in the uterus of a woman during a treatment cycle as per 24B. The embryos shall not be split and used for twinning in case to increase the number of embryos which is outside the body. You cannot do this twinning procedure. The collection of gamete posthumously shall be done only if prior consent of the commissioning couple is available as per 24F. And the clinic shall not use ovum that are derived from the fetus in any process of in vitro fertilization as per 24G. The ART clinic shall ensure that pre-implantation genetic testing shall be used to screen the human embryos for pre-existing heritable or genetic disease and when medically indicated. So this term has been added in the regulations. The ART clinic shall ensure that no pre-implantation genetics testing shall be done for sex selection, for non-medical reasons, or selection of a particular traits due to personal preference of the prospective parents, or to alter, or to view, or alter the genetic constitution of the embryo as per 13E. Donation of human embryo after PGT to an approved genetic lab only when positive for a disorder and after approval. The PCPNDT provisions will be followed, and again, sex determination and sex selection is not allowed. And there is only one exception: to diagnose, prevent, and treat of sex disorder-linked diseases, as per clause 26. In terms of the research within India, the research on human embryos, gametes within India shall be performed after obtaining the consent of the commissioning couple for transfer of such gametes or embryos to the identified empaneled research institutes and notified by the national board as specified in Form 9 and 10. Subject to revision of the guideline, the research under Subrule 1 shall be permitted as per the ICMR guideline or the stem cell research guideline or the biomedical ethics guideline as per the Rule 17. And again, this is a repeat: all unused oocyte for a donor shall be preserved and used on the same recipient. Now, I just put a few clauses to cover the donor aspect also. So the bank will determine the eligibility of the gamete donor as per clause 21A. The bank shall obtain oocytes from female between the age of 23 years and 35 years. So this is the age which is required if a female donor is there. There have been a lot of questions about anonymity, relatives, known, unknown. The law doesn't say anything about that. The law only says that the donor has to be between this age group. It can be relative, it can be known, it can be married, it can be non-married also. So all are okay. The screening and testing of the gamete donors should be done by the bank, and as per the law, there are these tests which are defined, which are the basic minimum that a bank has to do. If you have certain protocols at your clinic which you want to do more testing for the donor, you can always add on to that. Bank to obtain name, Aadhaar, address, and other details as prescribed, and shall undertake in writing from such donor about the confidentiality of the information. There is a difference between confidentiality definition and anonymity definition. Please don't get confused between confidentiality and anonymity. The law says that you have to be confidential of such information. The law doesn't say anonymity. The bank shall obtain semen of males between 21 and 55 years. Again, the same rule that applies on a female donor, the same rule applies on the male donor. The only criteria mentioned in the law is the age, nothing else. A bank shall not supply the sperm or oocyte of a single donor to more than one commissioning couple. Now, there were a few questions that since the IUI has a very low success rate, and if you're using a donor for a particular patient, once the patient fails in IUI cycle, can we use the same donor to do a cycle? Yes, you can. The clause 27.3 allows you for that. You can use the same donor to do multiple cycles for the same patient. So the law says that you cannot use a donor for more than one commissioning couple. The gamete of the donor or embryo shall be stored for a period of not more than 10 years. And at the end of such period, the gamete or the embryo shall be allowed to perish or be donated to research with the consent of commissioning couple or individual as per 28.2. And again, the sale and transfer is not permitted, which I have already covered in the past. An oocyte donor shall donate oocyte only once in the lifetime, and not more than 7 oocytes shall be retrieved from the oocyte donor. We have raised this issue in the National Board first meeting. Soon hopefully there should be some notification coming in this aspect. We will have to wait for it. But till that time, this is what the law says as per 27.4. And all unused oocytes shall be preserved by the bank. Now, because the ART Act and the regulation has said something different about the bank, because this particular aspect about the bank for female donor oocytes have been relaxed. So in case if the donor is getting the pickup done at the clinic, they can preserve the eggs or the oocyte or the embryos formed from that particular donor. Then you will have to have two things. First is the insurance, and second is the affidavit. The insurance, it's written that the intending couple or the woman will purchase general health insurance in favor of the oocyte donor for a period of 12 months from an insurance company or agent. And what it should cover, it should cover the amount which is sufficient to cover all expenses of the complication arising due to oocyte retrieval. The law does not say how much insurance you have to take, but you will have to take an insurance. I mean, you will have to advise the couple to take an insurance so that it covers this particular aspect. And you will have to ask couple to sign an affidavit in case of any death happening. The couple will be okay to compensate the donor in case of any death. So which is written as per the section 22.4.1. It used to be before to be signed by the metropolitan magistrate or the judicial magistrate, which have now been relaxed by a notification dated 10th October 2022, and now you can just do a notary for that affidavit. This is a form number 13. It is a consent for the oocyte donor. It has to be also maintained by the clinic. There is form number 14A and 14B. 14A talks about the sperm donation. 14B talks about the oocyte to embryo. This form will have to be maintained by the bank, and clinic will have to supply this information. But just as a safety measure, the clinic should also maintain this particular form. Now let us talk about the information flow, or what is that you have to maintain or submit. First thing is the confidentiality of the information has to be maintained as per the 21E. you can disclose the information to the database of the National Registry once it gets formed, or to the commissioning couple to whom the information relates to in case of any medical emergency, or if there is a court order by the competent authority, you will have to disclose the information. You have to issue a discharge summary with details of ART procedure being performed to the commissioning couple or the woman as per the 21H. The information which has to be provided to the National Registry is basically the enrollment of the commissioning couple or a woman, the procedure being undertaken, and the outcome of the procedure and the complication. Now, you will also have to maintain this complication part at all your clinics. So whatever data reporting systems that you have, make sure that this is properly recorded and documented in your system. Once the online submission starts, you will have to do the online submission in the National Registry, just like how we do it in the PCPNDT portal. And in terms of record keeping, all clinics shall maintain detailed record of all the donor oocytes, sperms, and embryos used or unused in the manner and technique of their usage in such a manner as may be prescribed for a period of at least 10 years, or closure of the clinic or the bank, whichever happens earlier. And if there is any criminal proceeding against any of the clinic, the record will have to be preserved till the final closure of the proceeding. And in case the clinic shall transfer the record to the central database of the National Registry upon expiry of 10 years. There is clause number 18, which talks about search and seize and seizure of the record. So every ART clinic or bank shall allow inspection at their place, equipment and records by the National Board, National Registry, State Board, or appropriate authority, or any officer authorized in this behalf. Such inspection of an already registered ART clinic may take place without any notice. The authority of inspection shall ensure that the entry and the search procedure does not take place at the risk of gametes or embryos stored in the facility as per the clause number 18. There have been some questions about grievous handling of the patient. So as per the clause, you will have to maintain a grievance handling cell. There is nothing written in the clause that who has to be the member. The ideal situation would be you can have a committee made within your organization, which can be 2 to 3 member committee. You should display at your location the members of the grievance handling committee, their phone number and an email address. And also there should be a remark that this form number 5 for any complaint that the patient has to make is available at the reception. So this is a form number 5. You have to take this form number 5 printout and keep it at the reception. So anyone who wants to put a grievance complaint, they have to fill this form and it has to be made available. In case of a suspension or cancellation of ART clinic registration, a show cause notice can be issued by the appropriate authority in case of a complaint of suspension, cancellation of registration. Appropriate authority shall be officers appointed by the central or state government as described in section 12. And you will have to reply to the submitted as per the show cause notice. There can be appeal which can be made against the cancellation or suspension of the audit of the order, and for a state it can be made to the state government, and for union territories it can be made to the central government as per the clause 19. And the state or the national board or the national registry can make periodic inspection or call for documents or material. The board officers have the right to enter, search, seize documents at all responsible time if the board has a reason to believe that an offense under the act has been committed. They will follow the provisions of Code of Criminal Procedures 1973 during the process. So all this is mentioned in 2040 and 21I. Now let us look at offenses and penalty. So first thing is, if there is any advertisement on the sex selection using a ART procedure, which is similar to the PCPNDT Act, there is an imprisonment of 5 to 10 years and a fine of 10 to 25 lakhs or both, which can be imposed. Then any medical geneticist, gynecologist, RMP or any person shall not abandon, disown, exploit or cause to be abandoned, disown or exploit in any form the child or children born through ART, or sell human gametes, run an agency or a racket or an organization for selling, purchasing, or trading of human gametes, import or help in importing in whatsoever manner human gametes, exploit the commissioning couple, woman, or the gamete in any form, sell any human gamete for the purpose of research. And if someone is found doing any of these, there is an initial fine of 5 to 10 lakh for the first contravention, and any subsequent contravention or a repeat of this mistake done, it may lead to an imprisonment of 3 to 8 years with a fine up to 10 to 25 lakhs. And there is one more clause which says, which is the point, clause number 34, which says, which is very important, whoever contravenes any of the provision of this act or any rules, the penalty is fine of 5 to 10 lakhs for the first contravention, and after subsequent contravention, there is an imprisonment of 3 to 8 years and fine up to 10 to 25 lakhs. That is why it is very important that anyone who is practicing as a level 1 or a level 2 clinic go through each and every clause of the law and make sure that they have made a SOP or a checklist to see that themselves as well as their staff knows that what the law is and they are working as per the law. In terms of the court, no court shall take cognizance of any offence punishable under this act, save on a complaint made by a national board or a state board or by any officer authorized by it. No court inferior to a metropolitan magistrate or judicial magistrate of the first class shall try any offence punishable under the act. And notwithstanding anything contained in the Code of Criminal Procedure 1973, all the offence under this act shall be cognizable and bailable, which is okay, but your surrogacy law says completely different, that it will be non-cognizable and non-bailable offense, which is not there in the ART law. That's the difference between punishment in a ART compared to a surrogacy. Let us look at who is being responsible. So where an offense under this act has been committed by any clinic or the bank, the executive head or the director of such clinic shall be deemed to be guilty of an offense and shall be liable to be proceeded against and punished accordingly, unless he proves that the offense was committed without his knowledge or that he has exercised all due diligence to prevent the commissioning of such offense. So as the executive head or the clinical director for that clinic, the onus lies on you. And that is why you should make sure that everything done at your clinic is as per the law. It also does not leave anyone other than the executive head who have been involved in this particular aspect. And as per the 32(7), notwithstanding anything contained in the subsection 1, which is this, where an offense under the act has been committed by the clinic or the bank, and it is proved that the offense has been committed with the consent or connivance of, or is attributable to any neglect on the part of any officer other than the executive head of the clinic or the bank, such officer shall also be deemed to be guilty of that offense and shall be liable to be proceeded against and punished accordingly. So it is not only the clinical head, but if the court finds that anyone else other than the clinical head is also involved in this thing, they will also be liable to be punished. I have talked about appeal against the authority in case of any rejection happen. There is a form number 4 which can be filled and applied to cover the section number 19. So this is the form number 4. I have made a few FAQs, but I think we'll cover it during the panel discussion. I think most of the questions might be the same. So I will just unshare my screen and hand over to.
Thank you, Dr. Nitin. You have very clearly elaborated what is the law and what is the level 1 clinic and what is the level 2 clinic and what is the various consent form says and what is necessary for each of us to follow and why it is followed. You are clear, very crystal clear. Thank you, Dr. Nitin.
Thank you.
Thank you, Dr. Nitish, for this detailed talk on ART law. And moving forward in this our webinar part, we are going to the most important part of this webinar, that is a panel discussion on ART law for every gynecologist with our national experts. As the audience of this webinar is not only the infertility specialist, but various gynecologists, and they have their in mind various queries related to their day-to-day practice regarding this ART law. So we will understand more in details the strength, weaknesses, threats related to this law, and a practical approach. So for conducting this panel, I'm going to invite the moderators, Dr. Randhir Singh sir and Dr. Shivani Sachdev. Can I see the CV slide, Ronak? Again, Dr. Randhir Singh sir is a well-known person, organizing chairperson, and he is working as an associate professor in Allied Medical College, director of Bhopal Fertility Center, Endoscopy Center, various awards and various presentations, national, international. Welcome, sir, to moderate this panel. Next slide, please. Dr. Shivani Sachdev is a director of SCI IVF Hospital. She is a clinical research fellow, Imperial College and Hammersmith Hospital, NHS Trust. Her featured in Limca Book of Record is well known. She is founder secretary of Delhi State Chapter, secretary in STAR, general secretary Delhi Chapter of HISPAR, ex-vice president Delhi Gynec Forum, and vice chairperson of Women Doctor Wing, IMS South Delhi. I welcome both moderators, and I request you to start this panel, and please invite your panelists. Over to you, Randhir sir.
Yeah. Thank you, Dr. Professor Shabana. I'll invite Dr. Shivani to introduce our respected panelist. CV, please.
Thank you very much, Dr. Randhir Singh and Shabana ma'am, for the wonderful introduction, and kudos on this excellent initiative and very, beautiful presentation, Dr. Nitish. You answered so many queries by describing them all so well. So we have a very star-studded panel of experts here with us. And I will request Dr. R.G. Patel, sir, first panelist. He is 20 years of experience in IVF, director of Sunflower Women's Hospital in Ahmedabad, and elected president for the GC chapter ISAR. And he is one of the members of the expert committee at the Central Board for ART and Surrogacy Regulation Act. So, sir, many congratulations on this very big honor. Delivered many lectures and part of all the international organizations. It's a great honor to have you here today, RG, sir. Can we have the next CV, please? And Dr. Manish Pankar, sir, one of the leading lights of IVF, doyens of IVF in our country, medical director, Nova IVF, past president of ISAR, and the senior associate editor of JHRS, board member of the Poseidon Group. Welcome, sir. Can we have the next CV, please? Dr. Sunita Tandulwadkar, ma'am, the head of Department of OBGYN and the chief IVF and Endoscopy Center of Ruby Hall Clinic, Pune, and world famous for her work on PRP and stem cells in infertility, the advisor and consultant at DY Patil Endoscopy Center, and founder, medical director, Solo IVF and Solo Stem Cells. And really, ma'am, salute you on your extraordinary achievement, India's first stem cell baby and world's first at the age of 45 years. So a big salute to you. Can we have the next CV, please? Dr. Biju, we have been all reading your, information on WhatsApp, all the comments that you gave, and finally, you are so elusive. So to catch you here in our webinar, really such a great honor for us. He's a consultant and director, SPM IVF and SPM Hospital from Kerala. Welcome, Dr. Biju. We have the next slide, please. Dr. Nitish, yes, he has already been introduced here. So a warm welcome to you again, Dr. Nitish. And can we have the next slide? Advocate Radhika, So Radhika, congratulations on the wedding in your family, and we understand that due to their commitments, you are with us as a panelist. So most welcome. She is the founder of Fertility Law Care, postgraduate from Punjab University, Chandigarh. And she has been interviewed by various national dailies, magazines, international. She's a very big media personality and a leading expert on the field of IVF and infertility. So I welcome all our esteemed panelists, and I'm just going to share my presentation. Yes, Dr. Monica.
Dr. Rajnikant is, I think, also in the panel.
Yes, I'm not seeing him here.
Can we just display CV so that if he joins?
Yes.
And the support team can kindly call sir.
CV has come. Yeah, CV has come. Sure. I'll introduce Shivani if you allow me.
Yes, the real Rajnikant.
Yeah, we call
the
him
star, superstar.
Yeah, superstar. He's like Rajni of the South. He's that famous that. So Rajnikant, everybody knows him. Last 25-30 years, he's the man behind us, saving us in the PCPNDT board and all, because he was the first gynecologist to support us from the central, like as now RG Bhai is there and Nitish Mudia is there. So he's a very famous, and he's very close friend to me. Wherever I call him, he's there always to help us. So please welcome Sir Rajni sir. Next slide, Dr. Gajen Tomar. Yeah, Gajen Tomar, my younger brother, who was the key person in the success of my Bhopal ISAR. I welcome Gajen here because he'll be the in charge of all the chat box questions of the whole 2 hours from Nitish Mudia to that. So Gajen Tomar, you are the key person again here in this success of this ART, because you have been representing the Indore, because in Bhopal we have smoothly got the registration of all ART centers. But in Indore, being it's mini Bombay, so the bigger you have the main little problems. So teething problems, seeding problems are there at Indore, but Gajen Tomar will try to solve that also. So now again, Shivani, come to the session.
Yes, so let us share the presentation for today. Okay, so today's topic is ART law for each and every one of us, each and every gynecologist. And these are our esteemed experts today. In the famous words of Winston Churchill, to improve is to change, and to be perfect is to change often. So as we all know, this Gazette was published December 20, 2021, followed by the rules which came in March 22. So our panel is going to be very practical, day-to-day practice. So let us start with the first question, and I request all the panelists to give their inputs for these questions. So couples is not getting pregnant and they go to a gynecologist in their neighborhood. So the question comes here that you are a simple practicing gynecologist. You see all kinds of cases. Can you counsel them? Can you do any investigations, or do you need a separate registration for counseling and doing investigations?
Anybody can answer.
Doctor, anyone? Sir, Banker sir, if you could start.
I think the ART law covers the practice where gametes or embryos are handled. So if you are not involved in an IUI or in an IVF ICSI procedure, if it is non-ART infertility practice, no gynecologist needs any kind of registration. This will be covered by the laws of general medical practice. If you are a qualified gynecologist, you can counsel and you can investigate and also carry out all non-ART treatments. This does not require any special registration.
Dr. Biju, would you agree? Dr. Biju?
Yes, madam. I do agree with Manish sir, because if you are a gynecologist was completed DG or MS or DNB, she or he can do the counseling. She can start the investigations. ART law specifically says regarding only the procedures, like it's such a handles the gametes outside the body, nothing to do with doing the investigations or counseling them.
RG sir.
Yes, yes, very agree, because after all in MD Gynec we are learning so many things about the gynec and infertility. We can take the history, we can counsel them, we can investigate them, and it's all no need of any registration for this type of work. If you are handling the egg or sperm for intention of the pregnancy and you are putting any gamete or embryo inside the uterine cavity, that is ART. So here you are not any handling any gamete outside the body, just they investigate and you can counsel it by the MD Gynec. No need of any registration.
So, Aji sir, when you do a semen analysis, it's like the semen sample outside the body. So that would be covered under this investigations.
Yeah, very true. This is some gray area for the investigation. We can do all investigation and semen analysis. It's under discussion whether we can allow semen analysis, PCT, or any analysis of the semen by the pathologist, whether we have to, pathologist need a registration, that is a gray area. So, but the intention for the only investigation, you can do it. If you are doing IUI and we are processing the semen or egg and then again putting the back to the uterine cavity for the intention of pregnancy, that is the handling, and putting back in the uterine cavity, that is ART.
Okay, sir. So, so we agree that semen analysis would be allowed. The question comes is that if you are only doing counseling or investigations, you do not come under level 1, even though the semen sample is being analyzed outside the body. And although the definition of level 1 ART clinic, where the investigation is carried out, diagnosis of type or cause of infertility, and only IUI is carried out as part of treatment, comes under level 1. So, Dr. Nitish, can you also advise us semen analysis if it's like handling of sperm outside the body as part of investigation? For that, do you need a level 1 registration?
I think I agree to certain part of what Dr. Patel also said, but there may be certain different interpretation with the state authority might have in this aspect, and semen being collected at any other place other than the registered bank or the clinic can lead to some misuse also. So it is again, I mean, from my side, I mean, this is a personal advice that anything being done in that particular aspect should be done at a level 1 registered or level 2 registered clinics only, because how the state authority will interpret it is again an area of concern and question. Though the ART law doesn't say anything about this thing, because what the ART law says is any handling happening outside the body which leads to any treatment or reproduction has to be under the act.
So if we go by this, I think every pathology lab also would technically require a level 1 registration if they want to do a semen analysis.
Yeah.
So,
I'll interfere here.
What would be the conclusion?
One thing, sir. Dr. Nitish, there as the act, the ethical or the principle behind this act is not to misuse. Bankers, sir, suppose my patient is coming to a center, routine pathologist, just he want to say the sperm count, and he assures that sperm is only analyzed and it is not used for creating the embryo or creating the IUI. You have seen the semen analysis and you have taken undertaking that I have just writing in proof that I have just examined and I have destroyed the semen sample, so it cannot be used for creating an embryo. What is your view, sir, Manish, sir?
No, I agree, but this appears to be a gray because I'm not very sure, but I think Dr. Radni would be able to tell that even under the PCPNDT Act, some of the semen some authorities ask for a report of how many semen analysis is done, even though it does not come under the purview strictly of the PCPNDT Act. So I think the PCPNDT Act is interpreting it like this. I think for the ART Act, the problem could be still even bigger.
Yeah, I think it is a gray area on the part of the both ART and the PCPNDT Act, because if you the Dr. Ranveer Singh said that if the and Manish Venkat doctor, I agree with you that if the semen, if every pathology must be lab is considered under the both ART clinic registration, right? But if the semen should be used for the purpose of the putting inside the for treating the patient, then it considered, because authority is not knowing what interpretation of the authorities are always different. As in the PCPND Act, all pediatricians must be registered under the PCPND Act, but till date, not a single pediatrician is registered under the PCPND Act. So better at this juncture, we consider that I agree with Dr. Ranveer Singh that that if you use for the IVF person, then it considered.
But then what if you are collecting semen and doing an intravaginal or an intracervical insemination? You are not doing an IUI.
Again,
people have been doing intracervical insemination.
Right.
But again, it's a handling. Again, it's a handling. So it's a coming ART1 only. What is happening practically, IUI, okay, we are doing ART level 1. But, and semen analysis, we already discussed whether the pathology required any registration or not. But in many areas, the IUI wash is done by the pathologist. That should be stopped.
Yes, I totally agree with you. That, yeah.
Need ART1 by the gynecologist. They can give medicine, gonadotropin, wash with their own lab, then put inside the uterine cavity by themselves and then same center. Don't send patient to the pathologist for washing the semen and back it. So that practice should be stopped.
I totally agree with you, RG sir. And RG sir, you and Nitish being a central key person, I think this act has come for ethical practice. In our conversation in 10 second pal, before 10 second, Banker sir told me that the loopholes, the misuse of the act is that instead of IUI, intrauterine insemination, if you are doing intravaginal insemination,
that is also a procedure.
So that all these are the deviation. So all this has to be stopped, because this must have not written in the act, but it is you can add, because it's not only IUI, it's a creation.
So let me read the definition again of the assisted reproductive technology clinic or procedure. It means all techniques that attempt to obtain a pregnancy by handling of sperm or oocyte outside the human body and transferring of the gamete or embryo into the reproductive system of a woman. It does not say which way. So any handling of the oocyte or a sperm outside the body, and you are trying to transfer it into the reproductive system of a woman, it will require to be done on a level 1 or a level 2 registered clinic only.
So I agree with this, but see, when you are strictly doing a semen analysis, you are not transferring back, but you are trying to do a technique which will help in attempting a pregnancy. This would be the broader definition then.
Yeah, so definitely I agree to what Dr. R.G. Patel also said, what you also said, Dr. Ranveer also said. This is a bit of gray area, and how the state authority will interpret this is a bit different, right? And there is a risk of misuse of the sample. If it goes to a non-registered clinic, they can use it for a donor, they can use it for any other aspect, right? So just the whole idea of, I think, the government making this law is to say that these procedures should happen at a registered clinic only. That was the thing.
So I think this will have very wide implications, and I think I don't know how the clarity would come in, but I think because this will affect practically everyone. I mean,
if we interpret a PCPND Act, they say that any machine capable of detecting sex of the fetus. So same way, this also we can interpret that way. Semen analysis, in my opinion, also semen analysis PCT has to be done only in a clear where the registration is being done, because semen they can misuse. They are when they as to there is scarcity of a donor. When it happens, anybody can misuse it.
So I think we have to, because we have got many questions and time limit is there. So I think to conclude is that this is just for your thought, Nitish. all the cities like my Bhopal and all cities where at least one ART level center is there in district, I think we should avoid the pathologist. But suppose a village is there and there is no, just a Sarkari doctor is there, government gynecologist, and there is a one private pathology. There is no ART1 registered also. So I think that at that level, we can allow the government. Now we'll go to the next question.
Right. So yes. So next question then comes. Thank you, Dr. Randeep. So the gynecologist, I am a simple gynecologist. I've seen the patient. Now I want to start some medication for her. The next step for ovulation induction, just for a natural pregnancy. Can I start her on tablets, or can I give her the trigger injection, or can I give her gonadotropin injection? Should I be registered if I'm doing that? So anyone, Dr. Rajnikant sir, if you can guide us.
Yes, as for the act, if you are doing giving the injection, you should register under the ART1 clinic. But I think that Nitish will be best person to answer on this.
So I had few discussions about this particular aspect, and what they have been saying is that for a basic treatment, which is using tablets, a kind of a very, very mild stimulation, or a basic level clinic where the patient would go and do the first kind of treatment, obviously they don't require level 1 or level 2 license. But as soon as you start using gonadotropins for a patient, obviously when he has failed those basic mechanisms of timed intercourse and ovulation inductions, few cycles of them, then only you will be putting gonadotropins on them for doing a stimulation. And ideally, when you are putting a gonadotropins, IUI would be a more preferred way, though there may be different practices of individual, but that would be more preferred way to go ahead with the cycle, because of the cost involved in the gonadotropins that you are putting on the patient. And for those particular clinics who are doing that, they should have a level 1 registration minimum. So the whole idea of making this act was that all the ART procedures should be done at a registered clinic, but of course not for a doctor who's doing or using these tablets and doing a very, very mild stimulation, which does not may not cause OHSS to that great extent when you're using a gonadotropin. So I think for a basic ovulation induction, timed intercourse, using a tablet, you should not require a level 1 registration. But if you're using gonadotropins, you should have all the facilities available at your center that you might even want to go for IUI. If you're trying to not take that particular aspect, it's just illogical. I don't see any logic behind that, and it is just you're trying to escape the registration. That is what the thought process that I gained from discussing and talking to the government.
But supposing there is a patient who has got anovulatory infertility, PCOS, not responding to oral medications, and you put the patient on gonadotropin, you just want to do an ovulation induction, a patient of PCO can still go into ovarian hyperstimulation in spite of the mildest stimulation. So technically speaking, if your aim was not for an IUI, you would not be covered or prosecuted under the Act.
But it's already discussion, it's RTI done. Any gynecologist using gonadotropin for the purpose of infertility or making follicle, they need ART1 registration.
So can I ask, see, a lot of is based on RTIs, but if you see the reply, every RTI begins that they are not obliged, and an RTI is not an interpretation of the law.
The answer is given by the DHR.
No, but
DHR
still,
is,
I think we have lawyers on the panel. I don't think opinion given in an RTI matters in any court of law.
No, Dr. Manish, I would like to interfere that what I like to advise the Dr. Nitish, Dr. R.G. Patel and the Dr. Biju, there are so many gray areas is there. So in your next meeting, you should specify, and Dr. Mansukh Mandya is very clear. He definitely accept your expert opinion that this type of the thing should not to be considered under the ART clinics, right? If I'm a gynecologist, if I give the gonadotropin, that I should not be considered as ART1 clinic. So my request to you on behalf of the IRT specialist, you should make the list of the gray area and shout the specification from the Geeta Narayan and your health minister. So it will be RTI doesn't need anything, and it is not sustained in the court of the law. So better it should be what the board is passing in their minute. It should be sustained in the court of the law. So my request to you, you should make the and represent whenever your meeting is there.
Yeah, Advocate Radhika, if you are there, you can answer the question raised by the banker, sir.
Yeah, hi everyone. Sorry, my
Yeah.
video is not there because I am in a family functions are still going on. So I'm so sorry. I'm sitting somewhere in the corner and answering these things. So, well, my first point is when we are talking about the RTIs, the reply given by the government is the perspective of the government, how they understand and what is the intent of the government, right? With the RTIs, how it helped the lawyers or anyone for that matter. Sometimes these RTIs answer the way you expect, the answer to be. So it gives a clarity. Okay, fine. This is what was my perspective, and the government also explained it. But at the same time, please do not expect that the government is going to explain you the law. That is the craft of lawyers, right? This is a wording, how it is to be interpreted, right? Those things happen sometimes, it's logical expression. We English language, we logical things, we understand it and we apply that. But government is going to give you limited answers, and more so you will see they will pick up that section and they will quote as it is, right? They will not go beyond it to make you understand because they will not put the expressions and give their own interpretation. That is one part of it. And second part of it, whenever we are talking about this ART clinics, I personally feel the way Dr. Nitij has said, and I think Dr. Patel has also mentioned, if you read the wording, it says with its grammatical variations and cognate expressions means all techniques that attempt. So now all techniques, there are steps to achieve that technique. For that matter, even a semen sampling, collection or whatever. So, or stimulation in a particular way. I personally feel that, the government is going to take a view to bring it under ART clinic level 1. Now, if you have a distinguished case where you feel, then the authorities will not work on every distinguished case. They are particularly going to draw major impressions and they are going to fit in that thing in that particular case. And if a doctor tomorrow is get caught up of doing a particular way and is very confident that mine does not fall within it, then court is the only result. So as Dr. Nitij has said, just if it is a stimulation which you are doing not for a time cycle and otherwise, just go in a level 1. So that is also my advice, that go for level 1 enrollment clinics if you are following any kind of practices which have, a kind of attempt to obtain a pregnancy by handling the sperm or oocyte outside the body.
So can I extend this? So what this means is that if a gynecologist wants to play ultra safe and wants to do anything except prescribing a tablet of clomiphene or letrozole, they should ideally have a level 1 registration.
Yes,
if you look at semen analysis, so it practically means the entire infertility treatment except the very, very basic.
Yes, absolutely correct. Absolutely correct. This was the agenda which was way back, going back in their mind. So this way they are also implementing the PCP-NDT Act because they wanted to handling of the sperm outside the body. They want to bring it. This was going, whenever I started the talk, I think 10 years back, this was the discussion that they want to bring this under their own arena.
But I think, the banker sir has pointed out a very good point where, he
pointed out and he explained in a very basic and a layman language in a very nice way.
But Radhika, you have to take us, the gynecologists, 40,000 gynecologists. You cannot at one day see. The USG is a different thing because USG is a investigation part like PCP-NDT. But it's not practice what the MS Gynae has been taught. There's one subject is their infertility. Now it's a PG curriculum also. And as soon as you do the MS Gynae, after that, suddenly on the practice day that you're starting, that you cannot do this. Because suppose I'm putting an example. Sir, your health minister is from Gujarat. I don't think Gujarat has got every place a gynecologist is at the city only. There must be at least 10% in the government job working at the PSC and CSC. Suppose my patient, one poor patient, cannot come to Ahmedabad. He has maintained that she's a severe PCO. Instead of 10 days injection, the patient required few early, like day 2, day 3, day 4. At the prescription of Dr. Banker, sir, a routine government gynecologist can prescribe and give, for example, a vaccination. Vaccination, not only the pediatrician, nowadays any MBBS, even the technicians are giving the vaccine, sir. And vaccine is like also a pediatrician's drug which has got the vaccine. So I think this is a gray area, and matlab ye hum I am very related to Foxy. Rajnikant, you know very well. Initially, the Foxy, when the sonography machine, I'm talking about the 2005, all the gynecologists, they need a certificate from a radiologist, because the IRA, Indian Radiological Association, was behind that. It will be snatching their bread and butter. So they wanted, there was a hidden motive. But I think being a gynecologist, Foxy president, Rishikesh Pai sir is not there, but we are basically a gynecologist, Foxyan. We don't want to snatch the right. It's like a human right of a gynecologist. Thank you, sir.
Plus, I think it is not only a question of getting your clinic registered. What comes after that is the problem for all of us. What kind of records you will need? You will be open to inspection. That is the bigger worry. I mean, getting a registration level 1 is the easiest thing.
Yes, sir. That is a
that kind of concern. You know,
amount 50,000 not a big thing, but yes, rightly said Dr. Manish, the record keeping, every IUI or any all stimulation, whether it is result in a pregnancy, misabortion, that all they have to keep record, and anybody can come. If you have once registered as a ART1, that is your responsibility to keep the record, and anybody can come to your place and they can search and do investigation.
Dr. R.G. Patel, it is not on that. See, if a semen analysis requires level 1, a gonadotrophin stimulation requires level 1, it means every semen analysis you will have to maintain records. Every ovulation induction with gonadotrophin done, you will have to maintain records for a period of 10 years. And this is a humongous task.
Yes, sir.
Yes, Dr. Banker, sir, exactly your point. And also, you know, sometimes patients take gonadotropin injections and they take the injection in X clinic, Y clinic with some doctor. They don't come always to your hospital to take an injection. So simply taking gonadotropin also somewhere X, Y, we don't know. The gray area, anybody can give, cannot give. We don't know which hospital. So
a very sincere request to our members to get some clarity, because this will, I mean, this might create problems either way to a lot of routine gynecologists. Someone who has already registered for level 2, it is fine. But for the 25,000, 30,000 odd gynecs, this is a very, very major issue.
So in this case, sir,
I would like to interfere one thing. My request to the R.G. Patel, Nitish and Dr. Beju, that same point I raised in the CSB, that if the semen collection is collected at your home, right, or anywhere in the guest house or whatever the place, then by law it should be registered, right? At that time, the health minister says, register karna chahiye. So I say by your act and law, this should to be registered. So then they realize, no, this is this should to be removed. So I think this type of the message you should pass on the on your next meeting. So they will definitely convince that we are right and this is a gray area and should not be dragged down so much by the authority to harass even the innocent gynecologists.
What about
a lot of importance? State level authorities have a lot of importance, because health is a subject in which state government is equally powerful as central government.
And sir, Radhika, I'll just, sorry for interruption, sir. Bankers are all respected people. Please don't think that this ART registration is only for a private sector. Or government sectors like AIMS and all. So do the one a gynecologist professor level, Dr. Shabana, you are in Medical College Bhopal. Soon you are going to start a infertility clinic. For that also, you are registered. But suppose a medical college, a PSC, CSC gynecologist posted, they are not registered, they cannot touch. And now WHO, sir, Banker sir, WHO has now identified infertility as a disease. So disease means it can be practiced at the lower village level also.
I think the point is we are not questioning whether this is right or wrong, but at least we should know what is right and what is wrong. That is the only thing.
Yeah, we have to make some line, routine gynecologist, and ART1 specialist, then ART2 level. So demarcation we need. to clarify. So those who are doing only short practice, they should not suffer, because otherwise they have some problem if they are given any HCG for the triggering, and this is like HCG is also gonadotropin. So if no any registered gynecologist can give HCG, that create problem, rightly say. So we should have some demarcation, what type of treatment can do without registration, what type of treatment we can do at ART1, and what type of treatment we can do at ART2.
It many times happens that even when you're stimulating a patient for an IVF, the final trigger, the doctor goes to any gynecologist or even a GP and takes the trigger. Now would that be allowed or not if that patient develops OHSS now?
So as per Act now, they are not allowed, no, sir?
I don't know.
As per Act now, it has been there. So I think it's a very,
there is a question in the chat box. I'll just pass it on to the moderators because it is related to the discussion going on. Can semen analysis be done in any pathology lab? Should the lab also take registration ART level 1 for doing the semen analysis?
I think we have discussed this a lot.
Already discussed.
Discussed. So we have done those now. So Shivani, we can shift to next question.
Yes. So sorry, it is hanging. So I'll just skip all these definitions, coming straight away to the next question. So to all the panelists, can you do a gynecologist for investigations if the couple is trying to conceive for less than 1 year? For example, if we have a patient, she got married at the age of 42 and they have been trying to have, or 40, trying to have a pregnancy for 6 months, can we start her investigations if they have been trying to conceive for less than 1 year?
By definition, if they have married and they are trying since 1 year and they are not conceiving, or they have any medical issues, then this is by definition they can investigate.
Sir, less than 1 year, because we see both extremes. In practice, I have a patient, she's married for 2 years, but she got married at 18. She's only 20 now. So I was in my OPD thinking, am I allowed? Should I start some investigation? Should I even do her AMH ultrasound, or should I just send her away? What should I do?
They have written, yes.
Sorry, that is the next question, the age one. This was for 1 year trying to conceive. Yeah, but the question will come for both. One is a woman who is less than 21, and the second one is if they're trying to conceive for less than a year, for both of these.
Yeah, so let sir complete first, then I can.
Yes, sir, Aji, sir.
Yeah, it's a defined infertility 1 year. They have given definition. If it should be 1 year trying without any contraceptive, or they have any medical issue, they can start the treatment. By definition, any medical issue or like age or yes, Nitish.
So as per me, I think if we look at the definition of infertility, it says that the infertility means the inability to conceive after 1 year of unprotected coitus or other medical condition preventing the couple from conception. So this 1 year criteria doesn't apply on few couple that you are particularly speaking about. I think it is more to do with the age of the couple in terms of a woman or a man or a single woman. That should be more applicable in terms of how a clinic would decide which patient can undergo infertility treatment or not.
But again, as I understand, the ART Act does not have any restrictions as far as non-ART infertility treatment is concerned. Am I right? So if you are doing a non-ART infertility treatment, so long as the couple is legally married, there is no restriction. I mean, is my understanding clear?
Yeah,
Yes,
totally.
I agree with you.
True. I think advice or simple medicine you can do because you are not handling any egg or sperm outside the body. So it's not ART. So simple.
No, that's So that's absolutely correct, Dr. Manish, what you've said. And also, while Dr. Nitish was explaining it, the fact that it was an age-based criteria. So the definition itself give that kind of, ability to, examine. Not only that, even if the lady has a less of age and she's complaining of certain medical issues, the investigations can be done. Investigations can be done to check an issue related to, what is causing them not to. So because then you have to write it on the medical prescription that they have approached us and this is the issues that we are seeing. And on that basis, we are, investigating the patient.
But I think now coming to this legal part, I think Banka sir has answered very properly that suppose Shivani was saying that she got married at 18 years and now she's just below 21 years. So if you're planning, if you're doing ART, either IUI or IVF, then otherwise routine timed intercourse or just getting the investigation, I think there should be no legal problem. Experts, please.
Yes, no legal problem. Yes.
Excellent. So I'm really happy that we have a very clear answer on this. And let us move on to the next question. So we have a gynecologist here who does ultrasounds and stimulation in her own clinic. She doesn't want the hassle, and so she's not registering for IUI or IVF. But she is seeing patients, she has patients, and she or he is doing ultrasound and stimulation in their clinic. Maybe they are giving only letrozole or only clomiphene, but they are doing the initial preparation for IUI or IVF. So what is the registration requirement now? Has anything changed for them?
No, because if you are stimulating for IUI, the gynecologist, the center should have a level 1 registration. If they're stimulating for IVF, the center should have a level 2 registration. That is my view. But I feel that is the correct thing, because who will be answered for the OHS or other documentations, counselings and all? Because the gynecologist who doesn't have a registration cannot take consent for a stimulation part or OHS part. She cannot explain. There is no counselling done in that particular clinic. The patient goes to the clinic where it's get done. The sole responsibility falls in that. But the hyperstimulation happens due to that the person who was prescribed the drug, the person who was who did the ultrasound. So if you are stimulating for IUI, they should have a level 1 registration. If you are stimulating for IVF, they should have a level 2 registration.
Others, please.
Yes, sir.
Yeah, rightly say, because rightly say if ART1, they can do IUI only. Because in for the ART2 or IVF stimulation, they need their proper counseling, consent, proper monitoring to avoid any complication. For IVF, better to handle all the case by the ART2 gynecologist. So this is hotly discussed, many times asked, whether ART2 registered the gynecologist or unregistered gynecologist can stimulate for the ART, for the IVF, and then they can send to the ART2 level. This is very, very commonly asked question. So different, like say same different doctor and different IVF specialist, different state authority, they are interpreting differently. So in my opinion, IUI, ART1 registration, do IUI, use gonadotropin, do IUI. IVF, ART2 registration is required. Better all the case should be handled by the gynecologists which are more trained in ART2 level.
So
if anybody is giving stimulation where they have proper degree and have 3 years of experience and already they are working, then you can put their name in your ART2 clinic, because very well experienced gynecologists, and they are already before the act they are doing this type of, but not having their lab, then they can stimulate, but having enough experience of the ART2 level.
So I have 2 questions to continue to this. Let us assume that I have a clinic at another place other than where the ART2 clinic is. I put my name in the registration. So when we do the registration, is the doctor registered or is the place also registered? It means if my name is there, I can stimulate only at that place, not at anywhere else. For example, if my clinic is in Ahmedabad, but I register at a level 2 clinic in Baroda. Can I stimulate in Ahmedabad because my clinic is not registered? Only I am registered. That is one. And second, if I cannot stimulate a patient for IVF if I am not registered or if I only have a level 1, can I use IVF as services offered on my board, or can I have IVF in my name? Because then if you are not qualified, how can you promote that you are offering IVF services?
Yeah. So can I answer these questions?
Yes.
Yeah. So to my understanding, I mean, the place as well as the doctor has to be registered together. I mean, if you are in Ahmedabad, but you got yourself registered under your clinic in Baroda, so I personally feel you can't do it in Ahmedabad, even if you have a unit there. You need to get registered there as well. Because their agenda is, registration is for the purpose that any activity that happens there, so they need to see the machine, the place, and the person. These are the main equipments or the main manpower or human resource and the place where the act happened are very critical for any case for them or their day-to-day examination. So it is important that the doctor needs to be registered there where the doctor needs to provide the services. As on date, I don't see them restricting a doctor to one unit. So far, I think everyone has a liberty to register them on different units. But they need to get registered is my advice also.
So Radhika, my question was, supposing I am an unregistered gynecologist. I am not registering my clinic, but I want to stimulate for IVF and I register myself in clinic B. Now can I stimulate at my clinic because I'm registered at clinic B, or if I want to stimulate, I have to do it only at clinic B, not at my place?
Yeah, you have to do it at clinic B. You can't do it at clinic A. The entire act has to be done where it is. So if you are doing it at some other place which is not a registered place, you will attract the penalties under the act. So if you are enrolling a patient, you have to showcase that the entire process was done there only. They condemn, is my understanding, when I speak to officers, and when I take an understanding, they say that, we know that there are these kind of models already running in the industry where there is one bigger unit and there are several places where stimulation is happening, and they do not advocate that to happen. They want that everything to happen under a registered place.
I think, Dr. Bankar sir, one more hidden thing is here that suppose you have got one center registered at by your own, and the other center is registered at your son, and your name is not there in your son's center. You cannot even practice there also, because same issues came in the PCPNDT also, Rajnikant, in the Mumbai and Maharashtra Kalyan, if you remember.
So it means the person and the place both need to be registered,
yes,
and everything should happen at the end place. So so then the question is, can such clinics use the word IUI, IVF in their name or on their boards and market this as services offered?
No, not at all. In fact, there are companies which have e-models now, right? They promote themselves. I feel they are doing a very tricky job. They are not they are only in the air, like they are on the online platforms. They do not have any sort of place, factual, but they say, okay, we provide these kind of services. And what they do is they get the patient and they send the patient to XYZ clinics, right? And the patient then lands it, and they also say these doctors are there. And the doctors to whom they are taking to, of course, the doctors know that this is the company which is getting us the patients, but that company is not registered anywhere with the government. Tomorrow, now whenever we are wanting to get an answer to our situation, I always say, let's go a little forward and then again go back. Now the patient has an injury or has some issue happened. Now, how did the patient came to you? From where did that happen? And that company is unregistered totally. Oh my God, it's going to be a very big issue there. So I tell them that you need to have a space of your own under the same name, so that, the government does not believe in any of these kind of online portals. Or you tie up with some doctor and take a name accordingly. So that is where my advice is. I hope I'm able to send across my point.
Yeah, very, very perfect, because you have answered indirectly. All the e-platforms has to be registered, and I don't think till now any Dr. Nitish, any e-platform has been done.
How will they do it? They don't have infrastructure. The government is saying level 1 needs this. The government is saying level 2 needs this. They don't have the infrastructure. How will the government register them? Government is open. Government saying come and register. with me. So the point is, the platform says we are trying to get the poorest avail this because we are availing competitive prices. That's not the agenda of the government. Agenda of the government is to establish standard of care, right? Tomorrow you close down your laptops and you run away. Who is going to catch you? Where this patient came? You know, IVF merchants of India. Somebody has suppose this kind of online platform, and tomorrow they are vanishing. So that is where these platforms are going to get a very big issue if they tomorrow don't.
And Advocate Radhika, in the Gazette also they have not mentioned even a single word about the e-platform and all.
Yeah, there is no, I mean, they will not understand. So see, I'm a lawyer. I'm in the court representing the patient who died because of some treatment, right? And see, now how will I present the case? I'll say, my lord, the case, there was some fraudulent company with the name of this, non-existence, non-registered. The moment I'm going to bring it that day, the mindset of the judge is overturned. No matter whatever you show your credentials, no matter whatever you tell to the court is not going to listen to you because your credentials are already hit by non-registering yourself.
But Radhika, my question was primarily for this hub and spoke model, which is very common, that there is one hub and there are 5 spokes where the entire stimulations happen. So effectively what you're telling is that either everything has to be a hub where everything is done, or it has to be a spoke where only IUI is done.
Where only IUI, yes. So how you can do is get them ART level 1 registered, and then make them a prescription whenever they want to escalate the case to a next level. Nova, then they write in Nova, this and this, we refer this case because this treatment has been done. Now the patient needs IVF, referring to the iUnit Nova. So this kind of, thing, or whether you want to write it, refer the right way or whatever way, you have to write it on your this thing so that it comes, everything is within the domain of the law. Tomorrow, anything happens to the patient.
But then the question is, if I have a spoke, I cannot call it an IVF clinic.
You cannot. Just say IUI. Just say ART level 1. Write it ART level 1. Don't even write. Yes, of course, you need to explain certain things. Sometimes, the layman does not understand what is ART. So you need to be very specific, the treatments offered there. So write that treatments offered there, but display that you are a level 1 and with your registration number outside. That the intent is very clear, that we are not, camouflaging things to, kind of misguide people.
One question, Banker sir and Advocate Thapa has come in my mind that after a gynecologist, Stri Rog Visheshagya, and they write evam Nisantan Rog Visheshagya, infertility experts. As per MCI, you cannot write. You cannot write unless you are a DM. Unless you are an infertility DM or clinicos. But now again, if I am a DM infertility DM MCS super specialist and I have not registered for ART1, can I write Nisantan Rog Visheshagya or not?
So you have not registered even for ART level 1? That's what you have.
But I've qualified. But I've qualified super specialist by MCI. I can write. Only the act has come, which is prohibiting me.
So now Nisantan Rog Visheshagya, infertility. No, don't write it. You're inviting the issues because infertility law is like this. Now see, this is what the act has done. You could have written it because there was no act. Now it has established a different, if you see, it has raised your pedestal to a level also, if you understand. It has made it a specialization and it has brought a certain standard of care to it, right? Whosoever is falling short of these standard of care is, getting implications under the law. So people cannot write all these things.
But again, Advocate Thapa, I'm LLB, I can write advocate, but I am not registered in the bar because 2 professions cannot do. So legally I can write advocate, but I cannot practice. So now answer to my question, legally I can write in Nisantan Rog Visheshagya, but practice nahi kar sakta.
So that's what I'm saying. So I would not suggest my client to put these kind of things, in the platform, because if tomorrow the case builds up, so see, you look from a different perspective, or hamara dimag, I mean, as lawyers, we always think negative first.
Yeah, because
I would always see that, why are you inviting trouble for yourself by writing this and trying to convey certain message in the society?
Yeah, I got it. But see, this is India, every city has a competition, and the press media because I'm in MCI, because a lot of questions now coming, every patient complaint is going to the chief medical officer,
Yes.
human right, MCI, everywhere the same case is going, consumer forum.
Yeah.
And everybody has got the same different jurisdiction. Criminal court alag hai, consumer alag hai, MCI alag hai. MCI cannot do any penalty fine. Only they can suspend your registration. So I think it's gray area. This is a short time, so now we can switch to the next question.
Yes.
Next question, doctor.
Yes, so thank you to everyone. It means that any gynecologist who's giving gonadotropins for IUI also has to be registered as level 1. Without level 1, the company cannot give you even gonadotropins. Basically, that is what we have come up. Now, number 6. Does this mean now that every gynecologist, are our panelists suggesting, or would you advise that everyone should have a registration with an ART clinic? Should everybody submit their name to some ART clinic?
No, it is not there, no, because if the place also needs registration, giving your name elsewhere does not matter, no. Because if you give a name to another clinic, you have to practice at that place, not at not that place.
So there was this thing which had come in between, that there were people were circulating that give your name, we will send your name, but that will not work if you are seeing patients in your own clinic. Correct? Okay. Anything else to add, Dr. Randhir?
I think this is a very important issue. The banker sir has taken that. At least if banker sir is registered in my clinic and he want to do a practice where just he want to have a counseling and just a routine A, B, C of the infertility, he should be allowed. I think so, sir.
Yes.
Yeah. So now next question, I think.
So moving on, gynecologists in training is going to qualify. Now they have planned that they are going to go into infertility practice. So what should they bear in mind if they are planning? These are for our young doctors who are planning to start infertility practice.
Banker sir, you can start. Banker sir.
I think if your ultimate aim is to practice ART, you should have a fellowship or a super specialty course, because I think today there are exceptions, tomorrow there will be no exceptions. So if you want to specialize into ART, the only way is to have the requisite fellowship training that is mandated by the law. Though the Act, I am not very sure, does it mention what kind of fellowship, how many days, which place? Is it a MCI accredited? I don't think the Act mentions all this.
Yeah, but there are now in India so many like DM degree in AIIMS Delhi, MCH degree in ART, DNB in fellow in ART. So 3 years of experience in any institute, registered institute, is required. During that 3 years, they can see how to counsel the patient, how to investigate the patient, what is ART, how to stimulate it, what is the result, and any complication arise, how to tackle it. But they has clearly mentioned that any ART registered clinic cannot train any IVF specialist. For that, rightly say, need some higher degree, very specialized degree like DM or MCH or fellow. Now, many in Manipal or like many centers, they have started very specialized course for 1 year, 2 year, 3 year. So that will be the future for those who want only IVF infertility practice in future after 3 year, 4 year, 5 year. They can join the course like DM or MCH or fellowship in a recognized institute. Then they can do practice in future.
So Dr. Ajit Patel, what is the requirement? Is it a fellowship degree, or is it 3 years experience, or is it
3 years experience in a recognized already running IVF for the Act, and 50 ovum pickup under observation.
So even if, let's say, I have a
if it is DM or FNB, no need of any 50 ovum pickup. But any routine MD gynae need 3 year experience and 50 OP. But for the DM or MCH or FNB, no need 50 ovum pickup. They just take degree for 2 year or 3 year course, like DM cardiology or DM neurology.
Yeah, because it is mandatory as a part of the degree that they have to do certain procedures.
Certain things during course they have to do because they are the very super specialist in ART.
So, RG bhai, my question is that first question, 3 years is okay time. So, recognized center, any. So, recognized center means suppose this center, as per ART Act, RG bhai, your center is now recognized. Dr. Randhir can come and do a 3-year training under you. Then I am able to open my center?
No, because again, any registered, you have little experience. But any ART cannot give the certificate of the any gynecologist to start their clinic. Those who are fresh, better to go for the DM or any fellowship or any MCH degree. Then they can start. So it will be more safety for all the career, and they can do have more knowledge about the all ART.
So at present,
his question was that even if I don't have a fellowship, but I work for 3 years at a registered ART level 2 clinic, I produce a certificate of 50 pickups or whatever it is, then can I apply or not?
Yeah.
Then you should be able to.
Then yes.
And the other thing, some of the fellowship course are only for a period of 2 years. So what do they do? Does the qualification of 3 years also apply to them? Because the FNB from national body is 2 years, and I've done the 2-year fellowship. Can I apply, or I need to, or I need 1 more year's experience?
It's written 3
No,
years.
it will be 3 years.
Not.
It will be 3 years after the fellowship.
After the fellowship, or you need 3 years?
Yeah, after fellowship or any DM or MCA, they need again 3 years of experience.
Yeah.
The only advantage of doing a fellowship is that you don't need 50 pickups.
So actually it means that if you want to do a fellowship, you will need 2 plus 3 years, so 5 years.
Okay.
So then what is the point in doing a fellowship? You can
No,
do a...
no, but Nitish just...
But
Nitish, but I think this was one time.
What is the advantage of fellowship or any MCH or DM? Like we are going for any higher institute to learn more detail about that. So fellowship and DM, you will concentrate only of this subject only. And you have to read, you have to give some examination. So it will be good for knowledge also. So after MD Gynec, go for any 3 years of experience of any fellowship or DM or MCS. It will be better for knowledge and for yourself also. You can do better than others, or you can justify your patient in future to minimize your complication.
No, my question is, RG bhai, is that as the Act says that one-time settlement was done, that anybody who is MS Gynae and has done the experience of 50 OPUs and 3 years. But now once the existing has gone, now we have to apply now on today, new one. So what is the minimum qualification of a gynecologist? I think a gynec under 3 years and ovum pickup of 50 will allow today?
Suffice. Yeah, it's sufficient.
Nitish, if it is sufficient today also, then in the future also, if I have to do only RT2 level practices, I'll come to the RG bhai registered center. I'll practice there for 3 years while go for FNB and fellowship.
For your better knowledge. Otherwise, if you come to me for 3 years, I will teach you so many things about the ovum pickup, and I am satisfied with you. I can give you certificate. By law, you can start. After 3 years,
but by law,
optional.
By law, I can start. If I want to have a feather on my biodata, I can go for that. Yeah, that's all.
But I think what I understand is because the number of fellowship seats are less, I think this 3-year experience has been kept. Maybe tomorrow, if there are 50-100 fellowship seats in India, they might use this experience and make only. So I think this is what is happening in the field of transplantation, in a lot of that. Till there are sufficient recognized courses, this other alternative interim arrangement has been given. So for freshers, it is always safer to have a fellowship.
That's a hidden thing. Yes, sir.
Thank you. Yes. So another very commonly asked question that if I'm doing IVF or IUI, my injections I'm giving to my patient in the clinic. So should I have a license and a pharmacist for drugs separately in my clinic?
I think as far as I have come to know, but medication in IU and IVF does the clinic needs, because there are two type of system in the IVF practice is that few hospitals, they charges only professional charges like ICSI and all. Drugs are totally different. So for them, they will not have a problem because they have in-house or a clinic, a medical store attached to the unit. This question problem will come to that place who have the package and don't have a legal licensed medical store. But like pediatrician, they buy the vaccination. So I think if you're buying the drugs, gonadotropins, the ICSI needles, the media, all, and you are not making a separate bill that IVF charges 1 lakh, gonadotropin charges 50,000, disposable charges 50,000. I think then they might be in the problem, because here the drug license needs a pharmacist always. This is my interpretation. I think the next experts will do.
If the treating doctor himself dispense the medicine, from there is no separate room. The medicine, everything is kept in the consultation room. Then we don't need to have a drug license. But I doubt in an IUI clinic or IVF clinic, is it possible to keep medicine, everything in the same room? It's in the rule, there are some item, there is an exemption in the rule. I had filed multiple RTAs regarding that. Even the court order also there. The court order is from multiple high courts. After that court order only, the government started all over the India, all different state governments started forcing the hospitals and clinics to take a drug license. If you are dispensing with your own hands, the drug is kept inside your room, then you don't need any license. And it is certain, no, so there is specifically written that certain, if the drugs are more than 1 lakh, 2 lakhs, then you need a drug license.
So I think this needs a very good, because legally it's always safer that you do the professional charges and have your medical store, and from a medical store the patient buys and then anybody can administer. Go on, Dr. Biju, this is your safest one.
Yes, sir. It's a different state. But the kind of practice is different in different places, because in my state, in Kerala, every hospital there's attached pharmacy. But I visited many other states and all. The hospital is they're given a place to a pharmacist. The hospital doesn't have to do anything with it runs the medical shop.
Yes,
it's like a medical shop. But in our state, it's an in-house pharmacy. Obviously, we need a license. But there are people who practices without license also. But if they are more than a doctor, if there's a second doctor in that clinic, then they have to take a license. If it's the medicine is kept in the different room, you need to take a license.
And one thing more I'll add, in Madhya Pradesh, suppose you have got a drug license of with a pharmacist and all, because no medical store can get without a pharmacist license. But I add to that, if you are having narcotic drugs, so like fentanyl, so that medical store has to take the narcotic license separately. So just I want to have, Biju, you are expert in that. Suppose you have got in-house a license of a medical store with the pharmacist. Do we need a separate license for this IVF ART Act? Because some conversation was there in WhatsApp group in our ART professionals. So routine medical license, medical store with the pharmacist for IVF, do we need a separate license like we have a narcotics license?
No need. No, our routine license will only needed. Routine drug license 20B or C, I think. That only we need.
But there was some WhatsApp going on that even purchasing a medicine for ART instruments and all, you have to have.
See, that is a new government rule, no, sir. Medical consumable. I forgot that. They have 2017. They have got a rule. Whoever is manufacturing, importing the instrument, they need to have a license. If whom they are selling, they also need a license. That is not strictly implemented all over the India. That traders, everybody asks for some time to a government.
Okay, so it's now at the teaching problem. So it is at the initial
implementing time. It's like it's an implementing process going on.
because their rule has come, but we should know, because I don't know, on this platform I'll share, we have got a rules of even in a hospital to use the underground water. If you have got a bore water, there is a rule that you have to take a permission. So most of the states doesn't have. So I think these rules have performed, but gradually it will come, I think so. Shivani and Advocate Thapa and Nitish sir. So this rule is in pipeline set. Any drugs, any instrument for ART, you have to take a separate license. That might come in future.
Okay. RG sir, Dr. Nitish, anything to add for this? For example, if I'm buying gonadotropin, they cannot bill to my clinic, they bill to the pharmacy?
I think at present our main problem is to implement ART Act and Surrogacy Acts. So this is the little different issue. I think so we should not, because it's a general issue. If you are antibiotic or any analgesic like fentanyl or a narcotics, for narcotic, definitely we need different license, permission. Even we have to preserve in a very safe area. We under lock, and we have to give some person to look it. So no, there should not be any misuse for our staff also.
You have to produce
for the narcotics very well. We have to preserve, but all medicine, other medicine we are using in like antibiotic and or anything. So they are from, we are directly purchasing or from the medical store also. I think it is a little more issue about the drug license. We have to see what exactly will go in future. But at present, I think anybody not having any different drug license for the gonadotropin.
I think is that this
in future may come. In future may come.
The act has passed in implemented December 2021. This obstetrics and gynecology, all these instruments and IVF media, everything added in June 2022. Otherwise, they would have included like that PND license, MDP license. They asking the inspector that check form which is given by the appropriate authority. They asking whether do you have a PNDT registration, you have a MDP license. This has been implemented after the ART Act.
So I think So Dr. Shivani, to conclude that because this webinar is useful for every viewership of the Indian general gynec and IVF. So if you're practicing, you don't have a medical store, as per Biju, you have to, for Dr. Monica, you have to have injection gonadotropin in your chamber, and by your hand only you have to give. I think that is okay.
That is a correct thing, sir. That is a correct thing.
Yeah. So I think we can shift to the next question.
Right. So now moving on to the different aspects. So a couple has come to the gynecologist. She has come with her sister and she says, my sister is planning to donate eggs for me. So can you do a general gynecological checkup for her? So can you do some tests or checkup? So for this, does the gynecologist have to be registered, or can any gynecologist do the checks?
The Act doesn't restrict any gynecologist from doing checkup of any of the patient. Right? Donor is also a woman at the end of the day.
So
when you are having this donor to be used on any couple, it has to be routed through a ART bank.
ART bank. Right. Even known sperm donor, you cannot take directly. Go to ART bank. Known sperm donor, go to ART bank. Do the investigation, proper counseling, signing, then they give the sperm at the ART bank, then the related sperm we can use as a donor. Same way, known donor, egg donor, better to go to ART bank after investigation, counseling, and through the insurance, and then they will come to the ART clinic. ART clinic can stimulate, make the embryo, transfer it, remaining embryo, you can do cryopreservation. All the information you have to put to the ART bank again, and ART bank will give information to the national register. That is the whole scenario. But known donor through the ART bank.
I think the question here is that even, let's say, the semen or the egg donor is known, the gynecologist or the ART clinic can screen the person before sending it to the ART bank, just to see that the person is fit to become a donor or not. That is the
we have to see. All are not fit for the egg donation. Maybe ovary small, or maybe tumor also. We have sometimes find malignancy in any routine checkup, or they are not fit for the even for the ovum pickup. So you can screen it.
And same can apply for a surrogate also, sir?
Surrogate doesn't have to be routed through the bank. So
no, but for initially, because we
in surrogacy, they need a fitness certificate by the and psychological certificate by the any RMP. What is written in Act, but as a safety, because you are the practitioner, and we are doing since many years. If you are doing surrogacy, because we need safety of the surrogacy. So for that, we need to investigate surrogate very thoroughly. That we are doing before the Act also. We are doing all the thorough investigation. We do see birth frequency examination. We do pap smear. We do transvaginal sonography about the uterus, mid-cycle stimulation about the endometrium. Also, I am doing a kidney screening, all X-ray, ECG, 2D echo. Everything will, because we need safety of the surrogate, because this is after all your responsibility.
So the take-home message is that
surrogacy thoroughly we can investigate by the gynecologist, by any unregistered gynecologist, by or any way. So this is
suppose if anybody is coming,
not the duty of ART bank, because in surrogacy you can investigate surrogate thoroughly.
So take-home message is that even if he's a donor, whether it is egg donor, sperm donor, or surrogate, their routine investigation can be done without ART1 registered doctors also?
I think yes, there is no any objection for this, just to screen whether they are fit or not.
Okay, so I think that is very good, important. So why I'm saying, because the surrogate, the patient from a remote area, from a village, might take her sister or anybody, and they can investigate at local level, initial investigations, and they can come to us, Nitish. So that is allowed legally.
Yeah, better so, because they are ready for their relative. This is altruistic surrogacy. They are ready for surrogacy, but we have to see whether she is fit or not, her uterus is okay or not, her other organs are fit or not. And other criteria definitely should be there. Age and should be married and Indian and everything should be there, but her fitness is very important. So now what practically
insurance and psychological fitness we can do, because this will screen out. Suppose we are searching for 4 surrogates, 4 relatives, at least out of 4, 1 will be the ideal fit.
One, yeah, exactly same happen in now egg donor, because now professional donor, not but known donor, altruistic donor. We are searching, and the couple are coming, many relative, and then we have to see to the egg donor which is willingly come, and we have to see whether she is fit for egg donor or not by gynecological, ovary, uterus, or any general issue. So better to screen, and you may screen 3 or 4, and 1 may become fit.
Yeah, and Dr. Nitish, just because this investigation routine also will cost. So suppose we are screening 1, 2, 3, 4 donors and surrogate. The being a hospital owner, we can charge from them, because investigation will cost to us.
Charge to the patient?
Yeah, patient.
If the patient is bringing their own donors?
Yeah. So the investigation cannot do, because they are like routine patients, no? I think legally we can charge. Otherwise, who will pay?
That should be okay. That should be okay, because there was RTI also, which was talking about this aspect, and the reply was the same, that all expenses incurred can be charged to the commissioning couple, but not the sale of the gamete.
Yeah. So because we are searching and we are making fitness to the available. Suppose we are taking 3, 4 surrogates and donors. So out of these 3, 4, only 1 will be fit. So all those 3 investigations will come to the cost. So that we can do.
See, that's an internal matter, but at the end of the day, whatever surrogate, not, I mean, talking about the donor, right? Whatever donor you are taking, it has to be routed through the bank, which is registration and screening has to be a part of the bank. You can do 10 donor checkups and you can charge the patient. That's a separate issue, because that doesn't take care of this part, because you will not be using the 10 donors for a particular patient, but the donor which you are using for the patient to complete any ART procedure has to be routed through the bank.
Yeah, so you have answered the question. So out of 10, if you have selected the 10th one, so only 10th has to be routed through bank. Other 9 you can do by your at consultation level, at clinic level. Okay?
Yeah.
That's the message?
Yeah.
Yeah, okay, yeah. So next question, Doctor.
Yes, thank you very much. So again, about oocyte donor, follicular monitoring for oocyte donor, does the clinic need level 1 registration? So if the radiologist is doing or a gynecologist is doing a follicular monitoring, simple, and she's an oocyte donor.
I don't think the Act mentions anything about the place of monitoring, but I think it is logical that the place of monitoring and the level 2 have to be the same. Otherwise, what is the sense?
No, sir, what happens is sometimes when we are in Delhi, we have donors in Gurgaon, and the couple says we will do their ultrasound in Gurgaon and come to Delhi on the day of egg collection. So many patients from UP, small places, they do the monitoring there, they send us the report and they come here only on the day of egg collection. So this was a question for those.
But Shivani, what happens is not only monitoring, even treatment happens elsewhere, because based on the report, you will advise some treatment.
Exactly, that is remote monitoring, which we all do. We all have done that.
So I don't know.
But Shivani, all law is for safety. Because again, better to have with your own place egg donor. You have to monitor, because again, the monitoring is a must. We need safety, because you trust on another person for the stimulation and monitoring, you may have trouble. That is my personal experience.
That is another thing. See, doing at your own place for safety is one thing. The question is whether it is allowed legally to be monitored elsewhere. That is the question. I mean, safety-wise, obviously, we would prefer everything at our own place. But does the law allow this?
Yes, so practically speaking, there are many scenarios like this where people do monitoring outside. So I wanted to know.
I think as per the experts, I think अगर आपके पास choice नहीं है तो you can ask any radiologist, but we should prefer as per Act कि that center should be registered for at least ART1, ART1 or 2.
No, it has to be
a radiologist. Radiologist, how can they register ART1? So it doesn't say in a rule where to monitor. And radiologist cannot register as ART1 because he or she is not gynecologist.
It is the same of the fever even for IUI also. IUI, if suppose you want to see the follicle of IUI, whether the patient.
So monitoring Act doesn't say about any monitoring.
So I think
Act is about the handling of egg and sperm and creating embryo and putting embryo inside the egg or sperm.
No, but see, if we feel that even administering a gonadotrophin requires level 1, then at least monitoring for level 2 should also require level 2, no? If we go by that same logic.
So yes, I think
yes.
I think registration. I think because Nitish, you told initially that anything if you are aiming for thinking of infertility to plan a child. So this follicular monitoring also comes to definition that you are planning a child.
Yes, so follicular monitoring is a technique aimed at achieving ART.
Yeah. So there's a gray area, Dr. Ajit Bhai and Nitish.
Again, gray area.
Yeah. So, but right. I think this should be, as per my and consensus, this should be allowed. They should be only allowed for monitoring, not for medication. Not for medication. Not for medication.
Not a problem. Not a problem.
But Dr. Randhir, what will happen is that if there is no clarity, this will remain at the whims of the local appropriate authorities, and this will be a big source of problem. This could be a potential source of problem.
So I think answer should be there, and the message should be there that they are doing only the follicular they are only diagnostic. No therapeutic part should be handled. Yeah.
Okay.
So so your point will be taken at the board. So I think Shivani, all these points. Next question.
Right. So next, although it has become really rare with decapeptyl with use of triptorelin and agonists, but if the donor has OHSS or if a woman has OHSS, so goes to a big hospital, they don't have an IVF center, there is a gynecologist attached, not registered to ART clinic. So can that gynecologist treat this woman for OHSS?
Yes, of course. It's a medical issue.
Any hospital.
Yeah, any hospital. Any hospital.
Yeah, any hospital.
Because Dr. Shivani, here the part of handling for gamete is not for the production of the embryo or child.
Pregnancy. This is safety of woman.
Yeah.
Excellent. Thank you.
Yeah.
Thank you. Now, this question has already been answered that any gynecologist can do a checkup of any surrogate mother because she is being screened to be potentially as a surrogate mother. No registration is required. Now, second is that, say, a couple comes to you to register the surrogate mother for antenatal care. So do you have to be a registered gynecologist, or any gynecologist can register and look after surrogate mothers?
I think Advocate Thapa will be very perfect to answer because insurance and safety are the partners.
So as long as the insurance cover is there, it's not necessary that the gynae needs to be registered with an ART. As long as it's a qualified gynecologist, it's now the pregnancy has happened, I think, right? And then for the care that has happened, so that's okay. I mean, as long and it's better that you maintain a record that she's now, for her checkups going to this particular clinic.
Right. So the place where the woman delivers in surrogacy need not be registered. It is only the place where she does IVF needs to be registered.
Absolutely. Only the part till your embryo transfer happens through different techniques is going to be registered. After that is required. I am a patient. I got my IVF done. I got pregnant. Now I don't want to continue here. I want to show it to another gynae who's closer to my place. Not required to be registered.
I fully agree this is allowed, but just a thought that supposing the woman does not disclose to that person that she is a surrogate.
Does not disclose?
Yeah, that she is a surrogate.
Because Radhika, birth certificate ke time, so you have to, the hospital has to say this is the surrogate and all.
Yeah, but the surrogate goes elsewhere to deliver and does not even disclose. So, I mean, she is the one who is doing a crime. It is not the doctor at fault. But still.
Yeah. So I don't think so. The doctor has a problem. It's the patient. This thing.
It is
but rightly say because of at birth, again they have to disclose because the gynecologist is the gynecologist. And the birth, how they will form the birth certificate? They have to disclose because it's surrogate mother because they have to.
Of course.
Birth affidavit.
So that is nothing the doctor need not to be bothered about the fact. I mean, it's patient should be particular about it, and should tell the consulting or the treating gynecologist that she is my surrogate and, we'll be bringing her under your care.
But practically speaking, I also wanted to mention this because as we were applying for surrogacy and some of the patients are at the last stage of getting permission, some of the hospitals, several hospitals are not open to delivering surrogate mothers because there is a lot of confusion that there is complication. So it is not so simple. Many people are afraid and they do not know and they are not really open to accepting or delivering surrogate mothers. That is the practical issue. And of course, the last question was in emergency. If a couple comes,
Dr. Shivani, just a minute to previous question that the Advocate Radhika, I want to clear from you that as per medical law, Nursing Home Act and 2010 Central Act also, any surrogate mother is now a patient. No hospital can say no to a patient.
Yeah, no. So let me tell you, after the passing of this new law, there was this big hospital, I will not name it. They were not taking the surrogate, saying it's closed. We will not take the delivery.
Exactly.
Then what happened is, the patient was in this thing, but because they got the paperwork done from me, they just contacted me that why Radhika, why is this the confusion? So I told them that make me speak to the concerned doctor or the person who is going to take a call or the legal team. So we immediately shot an email saying that this is what your ground of refusal is. She's a patient, you need to. And Within a couple of hours, they said, okay, we are going to give her an entry. So you rightly said, she is a patient. A patient is a patient. A human life is a human life.
But Radhika, 2 points to this. One is for the antenatal care and delivery of the surrogate, who is responsible? Surrogate herself, commissioning couple, or the ART clinic? Supposing there is an issue with or the surrogate does not come for care, who is responsible? And 2, I think every consultant has the right to accept or refuse a patient who is not an emergency. In a cold case, I can always refuse an antenatal registration.
Of course. That is true. Now, the point is, depending on various factors, if you have taken charges for the antenatal care, done a commitment, right? So then it becomes your part of obligation that you have charged the patient for antenatal care also, and that part becomes a part of your provided services. But if you're not providing that services and you're not inclined to take that services, you should mention at the very first step, as a matter of abundant caution, right? That you tell whenever somebody is taking this treatment, so that tomorrow they are not under the impression, oh, we were to continue the entire process here. So you can very well explain them that this is the procedure which is conducted here. Post that, we would suggest you try and look for another gynecologist where you will take the antenatal care. And maybe you can have riders under your prescriptions and everything. We are not responsible for any antenatal care. And also tell them that please do take this suggestion. Make the surrogate meet the antenatal care, because now the law is so strict. Tomorrow the surrogate may turn around and they said they forced me to deliver and show it to this doctor only, right? Just make her feel, is she okay with the system where the delivery is going to happen? Is she comfortable with the doctor? So that is the antenatal care part. And the delivery, of course, the delivery has to be, the patient should ensure that a tertiary care or a good mechanism should be in place where, her delivery can take place.
What is not written in consent in surrogacy is about antenatal care, about the twinning, about the was straightening, about the fetal reduction, and where to deliver. It is not written at all in consent. Later, you are dealing the patient. You have to streamline the treatment. You are doing procedure, but you have to keep in mind what happened at the end of the delivery, from where they will go. Better to keep with you or your colleague, because you have to need some collaboration with the obstetrician, which is very competent. Because all obstetricians are not compatible with any dire complication.
I think
you may need good circle, maybe your colleague, or you may need some collaboration with any corporate hospital also, where all ICU and everything is available, because we don't know at the time of obstetric what happened, like COVID, like dengue, like any infectious disease, like jaundice, PIH, not in your hand. So make sure you are capable to do all the complication tackle. Then and then you can avoid any complication or death of the surrogate. If once death had happened, it's become a more chaos. So you are, as a practitioner, better to understand treatment. You are based in treatment, you are giving result, but you should understand the end result of the pregnancy.
Arji bhai, you have told very perfectly, but as per new act, suppose the part of the ART2 level surrogacy is that the medical part, insurance part has to be done by the ART2 clinic. So our job is to that the treatment should be done properly, as you advised, Rajiv bhai, with the insurance cover. That
Randir, once insurance is there, they are good people. Once a complication happens, everything becomes chaos.
Yes, sir, exactly. When you face a complication, then the blame game starts. The gynecologist will blame the IVF doctor. The IVF doctor will say, I am not responsible, and the whole blame game will start. So golden words, Arji sir, really golden words of advice that keep with you with a trusted colleague of yours. Don't just let them go anywhere, because anything happens, a finger, they will point at you only. So we have run over time. So I wanted to give a very big heartfelt thanks to the organizers.
Before Shivani closes, just a few talks like about Dr. Gajen Tomar. You are there? Gajen Tomar?
I think he's there, but he's.
Call him because I think he has been in the 2 hours. Just I'm calling you because he has got a few comments to be done. So, Dr. Monica, you can call him.
No, I called him. He's not available right now. So
okay,
I will take over.
Anybody has seen the chat boxes? Very important things because we conclude otherwise.
Yeah,
yes.
chat box questions have been covered. Chat box questions have been covered.
So I think it was a perfect. Yeah. So Dr. Shabana,
yes, sir. Yes, sir. Chat box is not having any question. All the questions has been covered. And I congratulate Dr. Randhir sir and Shivani madam for such an excellent and informative panel discussion. I think everything is clear to each and every gynecologist and to the infertility specialist also. And the last part, I'm inviting Dr. Monica Singh for summarizing the points, we can say, key messages.
Thank you, everyone. And this is not going to be a summary. This is just going to be a big vote of thanks from me for all our faculty who have joined us on Sunday evening, especially to my very dear Bhopal Obstetrics Gynae Society, Bhopal Menopause Society. And there were so many questions being thrown in. Everything has been answered. There are the gray zones have been highlighted to the national faculty who can bring forward the concerns to the central authorities. And probably in the next session, we can clarify those. And very many thanks to our pharmaceutical partners, Dr. Vishal Dave, Intas Pharma. And thanks to the support team, Ronak ji, for being there. Thank you all and have a very nice Sunday. Thank you so much.
Thanks Nitish sir. Thanks Shivani. Thanks RG bhai. Then Biju. Thanks to Rajni bhai and all my local seniors, Rita Srivastav ma'am, Professor Shabana, then Srivastav ma'am and Shraddha Agrawal ma'am. So I think we have started this and we'll be having and all. And Nitish Muria, before your board meeting, if anything again we'll have. And you have created a very beautiful WhatsApp group that is ART professional. So he has ART professional. All these questions, recent questions, Shivani has taken from ART of dispensing drugs and from that. So these all come and always. Thank you.
Thank you. Thank you.
और होली की शुभकामनाएं सबको. Thank you.
Happy Holi to all of you.
Thank you so much.
Happy Holi.
तो बता ना ये अरे कर रही हूँ